How much precum is required to cause pregnancy?
Hey there! Welcome to today's video where we'll be discussing an important question. How much precum is required to cause pregnancy? It's a topic that often raises concerns and confusion, so let's dive right in and explore the facts.
Understanding precum.
Before we get into the specifics of pregnancy risk, let's first understand what precum is. Precum, also known as pre-ejaculate or Cowper's fluid, is a clear, lubricating fluid that is released from the penis during sexual arousal. It serves as a natural lubricant and helps prepare the urethra for the passage of semen during ejaculation.
Does precum contain sperm?
One of the primary concerns regarding precum and pregnancy is whether or not it contains sperm. While precum itself doesn't contain sperm, it can pick up residual sperm in the urethra from a previous ejaculation. If there is sperm present in the urethra, it can be carried along with the precum and potentially cause pregnancy.
Pregnancy risk and precum.
The risk of pregnancy from precum depends on several factors, including timing, fertility, and the presence of sperm. It's important to note that the chances of pregnancy are lower with precum compared to ejaculate, but they are not zero. Timing. The risk of pregnancy is highest when there is direct genital contact or penetration without a barrier method, such as a condom or hormonal contraception. If precum is released near the vaginal opening or if it enters the vagina during or immediately after intercourse, there is a possibility of pregnancy. Fertility. The fertility of both partners also plays a role. If the person with a vagina is ovulating, which is when an egg is released from the ovary, the chances of pregnancy are higher. However, it's worth noting that precum can potentially lead to pregnancy even outside of the fertile window. Sperm presence. The presence of sperm in the precum is a crucial factor. If a person with a penis has recently ejaculated and hasn't urinated or cleaned their urethra, there is a higher chance of sperm being present in the precum. It only takes a small number of viable sperm to cause pregnancy, so even a small amount of sperm in the precum can potentially lead to fertilization.
Reducing the risk.
If you're concerned about the risk of pregnancy from precum, there are several steps you can take to reduce the likelihood. 1. Use contraception. Employing a reliable form of contraception consistently and correctly, such as condoms or hormonal methods, can significantly reduce the risk of pregnancy. 2. Urinate and clean the urethra. Urinating and cleaning the urethra after a recent ejaculation can help remove any residual sperm, minimizing the chances of sperm being present in the precum. 3. Consider emergency contraception. If you're worried about a recent encounter where precum might have been involved, emergency contraception, like the morning after pill, can be taken within a specific time frame to help prevent pregnancy. To sum it up, while the chances of pregnancy from precum are lower compared to ejaculate, the risk is not zero. If there is sperm present in the urethra and it comes into contact with the vagina, there is a possibility of pregnancy. Employing effective contraception, urinating after ejaculation, and considering emergency contraception when needed are all essential steps to reduce the risk. If you have further concerns or questions, it's always best to consult with a healthcare professional. Stay informed, stay safe, and take